Thank you for tuning in. Today, I'm excited to walk you through the process of transitioning from an ACA marketplace plan, commonly known as Obamacare, to a Health Care Sharing Ministry, or HCSM, often simply called Health Shares. This is all about when you might want to consider making the switch and why it could make sense for you. We'll keep it straightforward, with a focus on the key benefits, backed by real examples. First, a quick history lesson on health shares. These programs started out as strictly faith-based initiatives, predominantly Christian, where members shared medical costs as an act of community and mutual support. Over time, they've evolved significantly. Now, there are dozens of options, including popular community-based secular plans that aren't tied to any specific religion. That said, it's crucial to note that all health shares, faith-based or secular, come with strict lifestyle requirements and rules around pre-existing conditions. The core idea is to avoid taking on large, ongoing claims from new members right away. They're designed for shared responsibility among healthy, like-minded groups. So, why have health shares exploded in popularity lately? The short answer? Cost savings. With rising premiums and deductibles in traditional insurance, many people are turning to these as a more affordable alternative. Let me share a few real examples from our recent clients at Clear Choice Health Insurance. Take a young family, a husband, wife, and 2 kids. Their subsidy-free ACA premiums for 2026 jumped from $800 a month to nearly $2,437. On top of that, their annual deductible skyrocketed to $7,000. That's a huge shock. Maybe you've experienced something similar? We helped them switch to a top-rated health share for just $549 a month. And get this, all medical bills are covered 100% after $1,200 per incident. Or consider a young man who just aged off his parents' plan. He was staring down an ACA premium of $1,100 a month. We found him a solid health share option for only $173 monthly. Finally, there's Joe and Kathy. Joe turned 65 and moved to Medicare, leaving Kathy without coverage from his old company plan. An Obamacare option would have cost her around $1,200 a month. Instead, we got her into a health share for just over $300. These are just a handful of stories. We see this all the time. Now, a key disclaimer. Health shares have strict pre-existing condition clauses, so they won't work for everyone. But when they do fit, nothing else even comes close in terms of value. Another thing to keep in mind, these plans typically don't cover routine things like doctor visits or lab work. You'll pay out of pocket for that $100 office visit or $65 lab fee. But honestly, how often do most people need those? Plus, most health shares include 100% coverage for telemedicine and urgent care, which can handle a lot of everyday needs without the hassle. So, how do you figure out if a health share is right for you? And how do you pick a strong one? With over 100 popping up these days, it can feel overwhelming. You could research them all yourself. This channel has several step-by-step videos to guide you. Or reach out to professionals like us who've already done the heavy lifting and keep up with the due diligence. We know the top performers, their faith-based or lifestyle requirements, and those all-important pre-existing rules. Think of it this way. Even if your family made 10 trips to the doctor in a year and paid full price at $100 each. And by the way, cash-paying clients often get discounts. But that's a topic for another video. You'd still save thousands annually compared to traditional premiums. Imagine what you could do with that extra money. Buy a better home, save for your kids' college, or build a rock-solid retirement fund. Before we wrap up, I strongly recommend working with experts like Clear Choice Health Insurance or similar pros who specialize in these plans. We've been in the health insurance business nationwide for over 30 years, and if you don't qualify for a health share, we'll help you explore other options that do fit. There you have it. I hope this sheds some light on your choices. If it helped, please like this video and subscribe to the channel. That's how we reach more people with these game-changing insights. Thanks for watching.